Hi everyone, welcome to Dental Exam Guide, and today we will be studying about Universal Numbering System. In our previous video about tooth numbering system, we have already seen the commonly asked questions from tooth numbering system and the history of tooth numbering system, the importance of tooth numbering system, general rules, Sigmundy-Palmer system, its advantages and disadvantages, and also in brief about Victor-Haddrup system. We could see that symbolic system or Sigmundy-Palmer system was not compatible with the keyboard notation, and because of the difficulties with keyboard notation of Sigmundy-Palmer system, in 1968, ADA officially recommended the use of another system which was put forward by a German dentist called Julius Parrot in the year of 1882, and that is Universal Numbering System. And today, Universal Numbering System is an interesting misnomer because it's not used universally now, it's used only in USA. It is the official tooth numbering system used in USA and it's also called as American system, and it is officially adopted by ADA in the year of 1975. Universal Numbering System uses continuous numbers and letters to denote each tooth. Numbering is done clockwise, beginning with the last tooth in the upper right quadrant and it ends with the last tooth in the lower right quadrant. Numbers 1 to 32 are used to denote the permanent teeth, and the uppercase English letters A to T are used to denote primary teeth. This is the universal notation system for permanent teeth. The maxillary teeth are numbered from 1 through 16, beginning with right third molar. The mandibular teeth are numbered from 17 through 32, beginning from mandibular left third molar. In this system, the teeth that should be there are numbered. Even if a tooth is missing, it is included in the numbering. For example, if the upper right third molars are missing, then the first number will be 2 instead of 1, acknowledging the missing tooth. So even if a tooth is missing or it is removed, the missing tooth is numbered in universal system. And this is the numbering given for permanent tooth using universal numbering system. Number 1 is maxillary right third molar, 2 maxillary right second molar, 3 maxillary right first molar, 4 maxillary right second premolar, 5 maxillary right first premolar, 6 maxillary right canine, 7 maxillary right lateral incisor, and 8 maxillary right central incisor. And it continues like this in a clockwise direction towards the tooth number 16, which is maxillary left third molar. Then goes down to the mandibular left quadrant, beginning with tooth number 17, which is mandibular left third molar. And again it continues towards the right quadrant in a clockwise direction up till the tooth number 32, which is mandibular right third molar. This is the universal numbering system for primary dentition. Maxillary teeth are designated as letters A through J, beginning with the right maxillary second molar. For mandibular teeth, letters K through T are used, beginning with left mandibular second molar. In the original system, 20 deciduous teeth were designated in the same order as in the permanent dentition using the numbers 1 to 20, which was followed by the small letter D to indicate that it is a deciduous tooth. But it was later modified to use uppercase letters A through T to denote primary teeth. Advantages of universal numbering system. The advantages include the concept is very simple and each tooth has a unique numerical or alphabetical code. It can be communicated verbally and it is compatible with the keyboard and it is easy for typing. And the disadvantages include it is difficult to memorize the notation of each tooth and need to practice. Another disadvantage was it does not consider jaw quadrants clearly, and similar tooth in different quadrants are given different numerals, and there was no relationship between the numbers given for similar tooth in different quadrants. So we can say there is no anatomic reference in the system, and matching a specific teeth and the quadrant can be confusing. That means only with a single number or a letter given for each tooth, we can't get any idea about in which part of the oral cavity this particular tooth belongs or in which quadrant it belongs, which was possible with Zsigmondy-Palmer system, where they used grids, and the shape of the grids gave us an idea of in which quadrant each tooth belongs. That's why we say there is no anatomic reference in universal numbering system. So that's all about universal numbering system, and next is few MCQs related to this topic. First question is, using universal numbering system, which of the following represent the 4 permanent adult canine? And the answer is option A. As per universal system, maxillary right canine is number 6, maxillary left canine is number 11, mandibular left canine is 22, and mandibular right canine is 27. Next question is, which succedaneous tooth erupt beneath the tooth J? We know in universal numbering system, the letter J indicate maxillary left second molars. Second premolars of permanent dentation replaces the second deciduous molars, and maxillary left second molars are replaced by maxillary left second premolars, which have a number of 13 in universal numbering system. So the answer is option C. And one thing that you have to remember is today universal numbering system is in use only in USA.